45% of the females in the United States of America have one or more of the following symptoms. That's a fact. So that's how I determine the 45% number that I use. And so that's how we defined prevalence. Now, how do you define incidence? Well, that's a little soft and mushy, but let's just use an example close to what I'm familiar with. I have one of our providers in Albany, Georgia, who's an oral maxillofacial surgeon, also a friend of mine, and also did his dental school at Indiana. And so I'm very familiar with Albany, Georgia, and the number of dentists and the oral surgeon down there. And so the incidence of Albany, Georgia can be calculated this way. And again, it's a little soft and mushy, but there are roughly 30 dentists, general dentists in Albany, Georgia. And, you know, with my experience out there in dental land, visiting my colleagues, I would guess that on average, out of those 30 practices, they would see, if they're interested, one patient a month who comes in complaining of TMD. Now, some of them would be more, some of them would be less, but just to say for discussion, one patient per month on average in Albany, Georgia comes into their dentist. That's 30 patients a month. Times 12 months, that's 360 patients per year have TMD and express TMD in a dental office. And then all you need to do to determine the incidence of TMD in Albany, Georgia is to divide that number by the population. Well, you don't use the whole population, just half the population, because only half the population are females. So the population in Albany, Georgia is roughly 70,000 people. So 35,000 people of that would be females. So 360 divided by 35,000 is approximately 0.01%. 0.01%. So if you compare the incidence of 0.01%, that is the number of people who come in and they express or been diagnosed or think they have the problem, versus the potential number who actually have symptoms, you're talking 450% more people potentially have the problem than know they have the